Thank you all so much for attending our session today. In-kind clarity, what's allowable, what's not, and why it matters. As we know, it's a big topic. My name is Carolyn Heiliger Graham. I am Senior Partnership Manager here at Learning Genie, and we're just so excited to have you all here today and kind of really talk through in-kind. We know that it's a hot topic, and we want to be able to best help you. And so I'm joined by my colleague, Ms. Suzanne Bursaw. And so she's going to help me out today. And she's our Head Start consultant, former Head Start director, and also a federal reviewer. So she has a lot of really neat tips and tricks that she wants to show us and just kind of keep us informed. So with that said, I'm going to go ahead and pass it over to you, Sue. But before I do that, just a couple of quick things to mention. We will be sending the slide deck after the session. You'll probably get that before the end of the week, probably by tomorrow, or at the very least by the end of the week. And in addition to that, we also will have a post-webinar survey. And so with the post-webinar survey, if you all complete that, it will enter you to win a special gift from Learning Genie, which essentially could be a discount or counted as an in-kind donation towards any of Learning Genie products. So we'd love for you all to enter to do that. With that said, Suzanne, I'm going to pass it over to you.
Super, thank you. So yes, my name is Suzanne Borsaw, and I was a previous director in Washington State for a program there for many years. Started there as an assistant teacher and did all those jobs in between, as many of you I'm sure have, and then was the director for many years before I moved to where I reside now in Arizona. So currently I'm a federal review lead, so I might have seen some of you on some of my reviews, and I love that work too. First, I just want to thank you all for joining us today. And I just want to thank you for all the heavy lifting you're doing out there for children and families. I know this has not been an easy year with the government shutdown, with everything that's been happening. So I just commend you for moving forward and continuing those services that children and families desperately need. And thank you for taking some time out of your busy schedules to join us today. So let's move to the agenda. So first, we've done the welcome, so we're all glad you're here. Then we're going to move into the foundations. We're going to understand the in-kind requirements. We're going to do a little bit of case scenarios, what's allowable and what's not. I'm going to go through some common pitfalls and audit red flags that might happen. Then Carolyn's going to take us through digital tools and best practices and give you some really hands-on tips for what we can do. And then we have some questions, and I just want to thank everyone for sending your questions in ahead of time. You're going to see them embedded in the presentation today. Those were really helpful for us to be able to prepare this presentation and make sure that you're going to get what you need from us. So, all right, so let's move into the foundation, understanding in-kind requirements. So as you know, the rule is from the 45 CFR 75.30C6, basic federal requirements. And the federal requirements govern all in-kind contributions. We're going to talk about what's non-allowable versus allowable. And we're going to talk about how contributions must be necessary and reasonable for the program. And I'm going to take you through those definitions. The value must be consistent for the standard fair market value. And we're going to talk about that a little bit. How do you determine those numbers? How do you get those in-kind numbers to match and things like that? And then we're going to address some common misunderstandings about parent participation. We're also going to really dive into documentation and how you're going to pass those clean audits. Okay? So let's talk about the 45 CFR 75.306, which is a mouthful. So really, we're going to go through the big four here, and it's called the big four cost principles. So all costs, including those used for non-federal match in kind, must meet these four criteria. So number one, it has to be reasonable. And this is 2 CFR 200.404. I'm just going to reference those codes in case you want to jot them down and look them up. So the cost is reasonable if, in its nature and amount, it does not exceed what a prudent person would incur. under the circumstances prevailing at the time the decision was made. That's a lot of legal jargon. So what is the key question you want to ask yourself? Was the cost necessary and ordinary for the program? Is it something that you would have purchased? Okay, so think about that. If you get a large donation of diapers, is that something that you would have purchased for Early Head Start? Yes. So that cost is reasonable. If you get a donation of, say, shoes for all children in the program or coats for all children in the program, is that something the program would have purchased? Probably not. Wonderful donation, very much welcomed, but that's not something you could count as in-kind because that's not something the program would have purchased. Okay, that's number one in the big four. Number two is it allocable? So if the goods and services involved can be charged or assigned in award in accordance with the relative benefits received, can you find that line item that would fit with? Okay. The cost is incurred specifically for the federal award and it benefits your grant. Okay. It cannot be shifted to a grant just to overcome a funding deficiency. Okay. So it has to be something that you would have purchased, something that your grant would have allowed you to purchase, or a grant would have allowed you for those expenses to incur. Okay. Number three, allowable. The cost is allowable if it is permitted by the general federal regulations. Okay. Excuse me. The cost must be necessary and reasonable and allocable. It must be consistent with your own organization policies and procedures. And it must be adequately documented. And we're going to go into all these specific details in here in a little bit. Number four, is it consistently treated? All costs incurred for the same purchase and in like circumstances must be treated uniformly as either a direct cost or an indirect cost. Okay, so they have to fit into one of those two categories. All right, so that was kind of the legal definitions of this 45 CFR 75.306. Okay, so let's move to allowable versus non-allowable. So in the context of this presentation on in-kind contributions, we're going to talk about necessary and reasonable as it defines the criteria for the donation to be considered allowable. Okay, necessary and reasonable means the contribution is essential for the program. It must directly support the program-funded required activities or objectives. It must be appropriate for the program's operation. The cost or value must be consistent with the standard fair market rate and what the program would otherwise need to pay for. And we're going to get into those specifics a little bit. And I have a sample allocation sheet I'm going to share with you. Is not already a required program cost. So time spent on mandatory training or performing general administration tasks that are typically done by paid staff is not a voluntary, necessary and reasonable in-kind donation. We're going to get into that a little bit deeper here in a little bit. Okay. So allowable. So let's move to this slide. Okay. So I have a couple scenarios, and I just want you to put in the chat whether you think it's allowable or unallowable. Okay. So the first one, classroom volunteers. What do you think? Allowable or not? Okay. I think you guys got this one. All right. Yes, it is an allowable in-kind contribution. So parent volunteers performing related tasks like helping in the classroom, sanitizing toys, leading an activity are generally allowable in kind. So, but however, attending required training is often a program cost or a non-allowable expense for the parent. That would not be an allowable in kind. Okay, so this clarifies the necessary and reasonable rule. Okay, so yes, preparing classroom materials, helping with meal service, setting up an activity, all those things that assistant teacher might do and the parents come in to help you with, that's all an allowable in-kind contribution. All right, let's look at the next one. Parent meeting attendance, allowable or unallowable or not? Allowable or not? Ooh, lots of different answers coming in. All right, let's look at this one. It's generally considered non-allowable in kind. Okay. So the parent meeting attendance, that's not a requirement for the program. That's not something that you would generally pay for or have that attendance be paid for. So it is non-allowable. Yeah, that's a shocker, huh? So if the parents are doing something that you would be paying for, a service you would be paying for, then it's allowable. For them attending a meeting is not allowable. Okay. All right, let's look at the third one. Learning at home, allowable or not? All right, let's take a look. Yes, it can be considered allowable. As long as the learning at home is assigned by a teacher and matches the goals that you and the parent and the teacher has set for the child. Okay. So I know one of the questions that came in was about toothbrushing and family style meals at home. That does not include, that is not an allowable in kind. So I see a lot of things, a lot of questions I want to address about the parent meeting attendance. So yes, it is allowable if they're doing Head Start business. So if you have your center meetings, policy council meetings, things like that, those can be counted as in kind. We're going to talk about rates in just a little bit. But if it's just a general parent meeting, say on your conscious discipline or how to have healthy meals, those are not in kind, non-allowable in kind. Okay. So yes, parent meeting attendance, if they're doing so, if you start your meeting with Head Start business, then yes, that portion of your meeting can be counted as in kind. Okay. All right. So let's talk about learning at home again. So it can be considered allowable. Again, it has to tie back to that child goal. It has to be assigned by by a teacher, sorry. And then you have to make sure that you have all that follow-up documentation. We're going to talk about that too. All right, let's move to the next one. Donated office space, allowable or not? Yes, I think you guys all got this one. Yes, if there is no cash being exchanged, they're donating all of your space, office space, classroom space, it is an allowable in-kind contribution. All right, let's move to the next one. Leased space. So this is a space you might be paying for. See a lot of no's, some yeses, some depends. All right, so let's see. So generally, it is a direct program cost, not an in-kind contribution. Now, there is a caveat to that. If you are getting that leased space at a discounted rate, maybe the market value would be so-and-so dollars, and they're giving it to you at a discount. You can count the difference, okay? You can, but you have to have some documentation. We're going to talk about that to back that up. So yes, you can count the difference, but if you're paying full market price for a lease space, it is not allowable. All right, one more. Professional services, allowable or non-allowable? So yes. Yes. All right, you guys got this one. So it may qualify as high value in kind. So this is if somebody's donating their time. Okay, so this is like if you have an attorney on your policy council, if you have Occupational therapists, speech therapists coming into your room and working with children and they're not charging you, that can all be counted and collected as in kind. Okay. All right. Good job. You guys really have it. All right. Let's move to the next slide here. All right, so this was a question that came up from all of you. So can practicum students' time be used as in-kind? Thank you, Pam, for submitting this question. And the answer is yes. Practicum hours can be counted as in-kind as long as they are performing tasks that are necessary to the program. For example, if they're leading an activity, preparing for an activity, so it can be counted. So they would log in, they would count their hours. Yes, even if they are from the public schools, if you're not paying them for that service and they're coming in and providing a service that you would normally pay for, maybe a third person in the classroom, maybe help with a student, then yes, you can count that as in kind. Okay? All right, so let's dig a little deeper. So let's talk about professional services. So high value services donated pro bono by an expert. Again, that legal counsel, your accountant, if there's somebody coming in and do vision and hearing screenings that would normally be of a cost to you, you can all count that as in kind, valued at their standard hourly rate. And you would probably have to get that from them because the rates are different in every state. Okay, so you can count that. Classroom volunteers, a parent or a community member volunteering time to perform program-related tasks, such as helping a teacher in the classroom. So yes, you can count that as in kind. If parents come in and they want to decorate the parent room for a holiday, that is not countable in kind. That is not something you would pay someone to come in and do. Okay? So let's talk about home learning and in-kind. Home learning activities assigned by the teachers can be logged as in-kind time by families. So examples include parent-child reading and a video book and watch time, as long as it's assigned by the teacher and it's meeting with the goals. Yes, grandparents are included. And as long as it's meeting the goals of the child, that home learning can be counted. We already talked about donated office space, okay? This is free use by this Head Start program where no cash payment is exchanged. Those are all counted. All right, let's talk about, here's another question. So are we allowed to count in kind for the portion of a family's home used during early Head Start and home-based visit? In a recent webinar, we talked about this, $1 per square foot. Haven't found any documentation confirming it. So allowable in kind. You can count the portion of a family's home used for the Head Start home visits as in kind. Not a home-based program, because the use of their home is a program requirement. Okay. Now, in the program I came from in Washington, we counted it as $1 per visit because we didn't want to just go through the market value for their home and square footage. So we just counted it $1 per visit. So it would be unallowable. So that same dollar cannot be counted for early Head Start home visiting programs for the reason I just described. Okay, that's a requirement that you're going into the home and that home is set up as their learning environment. Okay, so the space is considered a required cost for the early Head Start home-based program. Okay, so check with your regional office on this because I know that the guidelines for this has changed. And I'm with you, whoever submitted this. I couldn't find any detailed information confirming this, but I know that we always counted it as $1 a home visit, which doesn't add up to a whole lot. But you know, if you're doing 2 home visits in the home, you could earn some money that way. So let's talk about unallowable and why. So time spent by a parent or staff member attending mandatory trainings, as this is generally considered an expense to meet a program requirement, not a voluntary donation. Okay. So it's a program requirement, the time parents or staff spend in mandatory trainings. General administrative tasks. Volunteer time must be directly support the program required activities. We've already talked about the leased program space because you're already paying for that, but you can count the difference if they're giving it to you as a discount. So excessive or inflated valuation, and we're going to talk about this in a little bit, but claiming a value for donated materials or services that is not consistent with the standard fair market value would really be a red flag when you're getting through your review. For example, if you have a leased space that you just arbitrarily decided that should be $6,000 a month and they're only charging you $2,000, you'll have to have documentation back that up, which includes a realtor, getting that fair market value, getting that appraisal. All of those steps have to be in place for you to be able to count that. All right, so documentation details. So documentation is key, and you want to have clear, accurate documentation and not just a form-filling exercise. This is essential foundation for a successful audit and compliant, and it also protects the program. I'm sorry, I'm reading some of the chats. So we can go back to home visits for a little bit, for a second. So the home visit is a required program. So you cannot count the home visit as in-kind. It's a program requirement. But for Head Start, you can count that home visit space, not the home visit space. Okay, for early Head Start, you cannot count the home visit space because if it's a home-based program, because use of that space is a requirement. Okay, so hopefully that makes sense. So back to documentation, you want to record the source and specific type of the donation made. You need to know what was donated and who provided it. So was it a classroom volunteer? Was it a donated service? That needs to be documented. Date, you want to document that date. It is crucial for tracking purposes, especially for the time-based grants or budget periods. The valuation methods. Auditors will challenge any value that seems arbitrary, and we just talked about that. You must detail how you arrived at that fair market rate, whether it was a standard local wage, an independent appraisal, or a documented cost. You have to have that documentation. You have to have the supporting evidence. This is the most critical point. All claimed values must have backup proof. This includes signed volunteer logs, receipts for materials, or written statement for services. If there's no evidence, there's no credit. Okay, you have to have that. All right, so let's take a look at a sample in-kind wage. Oh, all right. Did I miss one, Christina? Okay, yeah. The in-kind wage scale for volunteers. So we have this, and this was my program in Washington State. We had the volunteers, the classroom volunteers, that's $33.21 an hour. That's just what we were paying our assistant teachers, okay? So that's where we came up with that number. But you're gonna have to come up with that number based on where you're located and what your, what your rate would be. And we included that rate for in the classroom, community members, home learning, bus monitors, and community event volunteers. That's the rate we came up with. And that rate did include the fringe benefits that we paid, okay? Now your policy council rates are gonna be higher because that is considered an executive number. So the officers of policy council, we rated them at $82.80 an hour. Community reps, same. And classroom reps, the same. And subcommittee members. So if you have any health service advisory committees, any other subcommittees where they're doing Head Start business, those rates can be higher because they are officially doing Head Start business. Now, if you have, say, a pediatrician or a dentist or something like that on your health service advisory committee, you can charge the rate they make an hour, which is probably going to be higher than that $82.80. Okay, so you have to do some research here. And you have to find out what their hourly rate is, and then you would plug that rate in. Okay, so professional services related to the profession. This is also health service advisory committee. Um, you would go with the rate that they are getting paid. School district professionals. Again, you'd have to do some research. What is their rate per hour? And this one was 61.95 was the rate that we came up with. And you do include that fringe benefits. Okay. Parent center committee meeting. That's business portion only. So you can only claim the business portion of the meeting. So these are some rates that we came up with, and we had a mileage rate, and I believe that mileage rate is now 0.71, the federal mileage rate, 71 cents a mile. Early Head Start, transportation to socialization events. You can count that mileage, the round trip mileage from their home. Okay, so for mileage for Head Start, you cannot count the mileage sent to drop off and pick up their child. That's considered a requirement. But you can count for socializations for Early Head Start. Okay, and you can see here that we counted that education home visit space as $1.03 an hour. Now you can count the physical and dental appointments for mandated child outcomes. This are your oral and your medical health determinations. You can count the hourly rate for that the parents are bringing their children in for those required medical and oral exams. Okay, those can be counted. Again, you're going to have to do the research for what is the fair market value for these things in your region or your state. And you can use, you've all done that comparable wage study. Use those numbers, and you can use those numbers to plug in your in-kind wage guide for volunteers. And we just had this as a handy go-to document for us to. And again, yes, the OT-PT visits, you're going to want to know what their rates are. All right. Here is another question on mileage. Can parents claim mileage? If so, what qualifies for this? So allowable mileage can be claimed as in-kind if it is necessary and reasonable and directly supports the program's funded activities. It's generally not allowable for drop-off and pickup, open houses, because those are considered the parent's personal expense or time fulfilling a basic program requirements. That's what makes it non-allowable. All documentation must be claimed. The claim mileage must be accurately documented, the date, purpose, distance, and valued at the program's current approved mileage rate. Okay. All right, so let's look at some common pitfalls and red flags and audit red flags. So the most common pitfalls are missing or incomplete in-kind documentation. So documentation is the missing and incomplete paperwork is the #1 reason in-kind is disallowed. So every hour and every dollar must be backed up. Okay. Another common pitfall, the volunteer time is not linked to program objectives. The volunteer time must be clearly linked to your program's funded objectives and not general or vague activities. So recruitment, if you have parents involved in your recruitment activities, that is a funded objective, right? We all have to have a recruitment. And if parents are volunteering for that, the programs would be paying people to do that. So that is an allowable in-kind. So if you have parents participating in that, collect all that. Okay. Consistency. Never reuse the same donation or volunteer match across multiple grants. It must be attributed to only one. Ensure all valuations are fair, reasonable, and consistent. Inconsistent or inflated values are major red flags. Okay. Timing. Avoid the scramble of catch-up reporting at the year end. Late or last-minute reporting is a sign of poor controls to an auditor. You want to be consistent. Okay. What I meant by using the same in kind, if you have, for example, there's a child in Head Start and there's a child in Early Head Start, and you have a parent who's doing the same activity with both children. You want to be careful and make sure that those activities were tailored to that specific child. Just doing a blanket in-kind acceptance in both of those grants could be a disallowance. So you want to just make sure that you're not counting the exact same thing for both grants. They have to be tailored specifically to that grant or that child. Okay. All right. So auditing red flags. In-kind entries rounded or identical. So for example, everything's rounded up to the nearest dollar. That's probably a red flag that we're going to look a little deeper. Sign-in sheets are missing purpose or signatures. So you just have a blanket sign-in sheet. Parents are signing, not putting in the purpose. There's missing columns. That's going to be kind of a red flag. You have donations without supporting valuation or source details. Again, you can't just arbitrarily pick out a number and decide what that's going to be. You have to have some sort of evidence to back that up. Large spikes in-kind near fiscal end. So in-kind is something you should be collecting all year long. Okay. So let's talk about the 20% match for a second. So what is the purpose of in-kind? In-kind is to make sure that parents and families and your community is involved in your program. So we want to see that happening all year long. We don't want to see that spike at the end where everybody's scrambling for those in-kind numbers. We want to see consistency. Okay. Lack of reconciliation between reports and backup documentation. You want to have all your ducks in a row. You want to make sure that you can count that and make sure that it's not going to be disallowed. If there were contributions accepted but unrelated to Head Start services and you counted those as in-kind, we really want to make sure that whatever you're counting as in-kind is truly allowable. So the key takeaways, you want to be accurate, consistent, and timely. The documentation protects your program and it ensures that you're in compliance. All right, we have a question. Can we use in-kind hours if the person doing in-kind is under 18 years old? And I had to look this one up. So this was a great question. So I learned something here, and yes, you can count it. So the federal focus doesn't really focus on the age. It focuses on the service itself. So again, you have to ask yourself, is it necessary and reasonable? Is it something I would pay for? Is it directly supporting funded activities? Is the value consistent with the standard for fair market value? Is it properly documented? So you want to have some policies and procedures in place for this, however, because you have to have child labor laws that come into effect. Is the child supposed to be in school when he's volunteering in your program? You want to have some clear policies and procedures outlined for people working, for children under 18 working in the program. Now, I know that a lot of people do senior projects. We had that in our program, and we did count that as in-kind, but we had all of the documentation to back that up. So, all right, that was a great question. Thank you for submitting. So let's take a minute here to talk about waivers, okay? And I know that a lot of waivers have been granted in the past for the non-federal share. A lot of those waivers are being looked at differently now. So I wanted to just go over the 5 criteria for receiving a waiver. So the first one is the lack of community resources may prevent the Head Start agency from providing all or a portion of the non-federal contribution that may be required. Okay, maybe there's things that are happening in your community and you just don't have those resources for health or dental or your health advisory board. Maybe some of those things have dropped off. You want to have documentation for all of this. The impact of the cost of the Head Start agency may incur in initial years it carries out such a program. So the impact of the cost of the Head Start agency may, I, I think I'm missing something there, may incur in initial years when it carries out such a program. So if you have an initial cost that really came up for you and you're not going to be able to have that in-kind match, then you want to have that documented. Same with an impact of an unanticipated increase in the cost of the agency. Whether you've had a major disaster in your community, a hurricane, and we've had some of those, impact on the community that result if the Head Start agency ceased to carry out such a program. Okay, so those are the 5 criteria that really they're going to be looking at for that 20% match. The waivers would only apply to one budget period. And if needed, the non-federal entity must apply for a new waiver for any subsequent budget periods. And really, your regional office is the one who's really going to support you with this. They're really going to give you the details on what you need and what you need to have documented to apply for that waiver. Whew, we went through a lot in a short amount of time. Gosh. So I tried to catch your questions as they were coming in and answer them, but please keep putting your questions in the chat. We really want to do a follow-up for this because 45 minutes is just not a whole lot of time to dig into this. But I really want to turn it over to Carolyn so she can really talk about, we've talked a lot about how to collect the document needed. Now we really want to get to the practical sense of it and what digital tools and best practices you could put into place to make all of these things happen for you. And as we know, collection of in-kind is really cumbersome. I know that we had one person doing it in our program, and it would take her literally the first 2 weeks of the month to get it all added up, put in a report, something that we could use and look at. And Carolyn's going to share some great strategies for streamlining that process. So Carolyn, go ahead.
Yes, absolutely. So yes, Suzanne, you have shared a lot of information. We have a lot of questions in the chat, and there's some that went into the Q&A session. So I'm going to try to go through this quickly to see if we can answer some of the ones that we might have missed during this session. So yeah, why digital? So we talked a lot about like making sure that you have good documentation. But the big thing when you move from paper to digital tools, what that's really going to do is help your program reduce risk, and it's going to save you time, which, as we know, none of us have any time. The other key component to that is data errors. Misplaced sign-in sheets, inconsistencies, how many times people forget to sign things. With a digital platform, what it does is it creates a clear timestamp trail for pretty much every kind of in-kind entry. So that's really going to be important. So we have some recommended tools. So of course we are with Learning Genie. So Learning Genie is definitely a tool. I don't know if any of you are utilizing Learning Genie currently, but we help you all digitally track your parent and community volunteers. And it's designed specifically for Head Start programs in mind. So it allows for you to log your staff and family volunteer hours very easily. You can attach activity details and link contributions, and it's real time. So it's the difference in when you're doing a manual process. These things are not in real time. So you have to gather the information. Then somebody is then entering it into some place as opposed to it happening in real time and getting real reporting data from that. Some other options, Google Forms, Sheets, Smart Sheets, or Airtable. As you know, I know everyone's saying we're trying to go paperless. So we know that in-kind can be an extremely daunting task. And so by using a digital platform, that's really going to help you all take things to the next level, save you time, save you hours, and just streamline that process. Now, some key features that you all want to look for as you're exploring digital tools. Of course, we'd love everybody to use Learning Genie, but you want something that's mobile friendly. So being that people can access it very easily, regardless of the device that they're using. You want something that's going to have built-in verification. So where people can sign electronically, timestamps, You want real-time data. You don't want to have to wait on things. It should be able to instantly give you the information that you need. It should automate your summaries for you so you're not like, okay, I've got to create another whole report to pull this information. And you want it to be cloud storage so it's easy to retrieve and it's easy for you to report on. So with that, I just wanted to kind of give you just a little bit about what Learning Genie does or has to offer. So I included this little screenshot of a dashboard. It's kind of a summary report, basically on what Learning Genie does. And it's really designed to simplify and strengthen how Head Start programs track, verify, and report their in-kind contributions. And so one of the biggest challenges that we hear from programs is that manual process that is extremely time consuming and also difficult to audit. And so our goal is really to eliminate that complexity and just really give you that real-time visibility in our progress. So this summary report gives you a full breakdown of all of your different contribution types, your at-home activities, volunteer, mileage, donations, all of that. And you'll also be able to see the visual charts because everyone loves a nice chart. You no longer have to create it. It's something that's part of the platform. And so overall, the idea is it's designed to reduce your manual work and increase your accuracy. Now, if we go over to the next slide, one of the key things is it's not even just being able to digitally track things like sharing at-home activities with families that count towards in-kind, but thinking about your volunteers, how many times they're writing a paper form and then somebody has to enter it into a system. So with Learning Genie, your community volunteers can actually log their volunteer transactions digitally. And they don't have to have a Learning Genie login or anything to do that or the app. So it really kind of gives you that real time information, but makes it a lot easier for your volunteers to be able to easily enter their information in. And then lastly, we do have an app. So we have apps for families. So we call it the parent app, and then also for your team members as well. And so we call it the educator app. But realistically, families are able to very easily enter in their at-home activities. They're able to log that. And even if they come and do volunteer work, which is one of those things that count, they can easily log that in the app. So we did want to share with you all if that's something that you all are looking to provide or use a tool, we definitely would love to continue the conversation. With that said, we offer um, a lot of different solutions. So some of you I noticed in the chat mentioned you're using Learning Genie. So in kind is one of them. Family engagement. We also have a really cool curriculum. We have a unit planner that's powered by AI. Some of you may have attended some of our AI sessions. We have an assessment, the DRDP assessment built into our platform, and plus much, much more. So if you all are interested in continuing the conversation and learning more, you can scan the QR code here, and we will be in touch with you, and we can kind of further that conversation to start doing things digitally. I know that there's so many of you all that have put in a lot of questions in the chat. Just want to make sure that you all are aware. You all, yes, will receive a copy of the recording. You'll get that copy, and then you'll also get the slide deck as well. So I know a lot of people were asking, will we be sent that? You will get all of that information. And I just want to reiterate, we are also doing a quick post webinar survey. We really encourage you all to complete that because there are so many questions. And as Sue mentioned, 45 minutes is not enough time to talk about in-kind. We could probably do this for hours and hours and hours. So if there are any specific topics within in-kind or family engagement or any of those things that you would like for us to discuss, we're planning our webinar series for the next year. So we definitely would want to hear your feedback with that. So please scan the QR code if you're interested also to learning more. I know we are just at time, but if there's people that want to stay on for a little bit, and we can answer some of the questions that we might have missed that were in that Q&A piece. So we thank you so much for attending. So for those that want to stay on and get their questions answered, feel free. I guess we can go to the Q&A session
Yeah, and I'm trying to
section.
type in answers.
Yeah, I figure it might be
So
easier if we
people
just
have to,
answer it. Yeah, so that way it's recorded and that way they'll get the recording so they'll be able to see what
yeah.
the answer is. Um,
So there
so there
was a
was,
question, a couple, I'm just trying to find multiple questions. So there was a question about if clothing, coats or shoes are donated for children who might soil their clothing and they're kept in the classroom, if those can be counted as in kind, and the answer is yes, because they're not going home with families. So you would be purchasing those items for your classroom for students. So yes, you can count those things. Um, if the facilities and technology staff work in another located off-site, their office space where they do work for our program can be claimed. Again, you can only claim office space for in-kind if you're not paying for it, if it's donated. So it doesn't matter if it's off-site or on-site, if it's for program, if your tech group is located off-site and that office space is being donated to you free of cost, you can count that as in-kind. Um, Gosh, Latasha Ferguson, I don't have the answer to that one. For a family home center, can the director submit grocery shopping and washing laundry as in kind? And so you're talking about partnerships with family child care centers. I don't have the answer to that. I would have to look that up. So that's a great question. I'm going to save that. Um, Discuss school department personnel again. If they're paid by the school district and partial federal funds to do their job and provide the services to our children, is that still allowable? So a lot of times they're paid by the school district for their jobs with the school district, but they're coming into Head Start classroom and providing services, and those services are not being charged to the grant. So yes, you can count those services as in kind. Now, if you're paying the school district some sort of administration cost or some cost to provide those services, then no. But if you're not paying the school district to provide those services, they're coming in, providing those services, then yes, you can count that. If we have community members like the police department, fire department come in and talk with the children, yes, you can. Okay. They're donating their time, they're coming in and providing a service, so you can collect that as in kind. Um, why can't parent trainings be counted if they are voluntary and support their goals in education? Because they're not a required program. They're not a program requirement. Parents don't have to attend parent meetings. That's something they can choose to do if they want to. Now, for as far as participation in home visits and home learning and all of that, those are program requirements as well. And so you can count those. But attending the parent meetings is not a program requirement. Okay. Is there a limit to the number of hours that can be documented at home learning? Example, a teacher assigns a reading on Friday at 7 times 7 for the next 7 days. Is that a red flag? So again, you're going to be the one looking at those home learning activities, and you're going to be the one approving them and discussing it with the parent. Yes, if they're doing that all 7 times for the next 7 days, if they're reading 15 minutes a night, yeah, you can count all 7 times. But if you're getting an excessive amount where you're getting a home learning activity that the child is sitting down working on colors for 90 minutes, you're going to have a discussion with that parent. Is that appropriate? Did that really happen? Or you can count 30 minutes of that. You can count 20 minutes of that. You're going to be the one approving those activities. Okay. So when developing the value of the classroom volunteer, do you use the pay plus fringe for the lowest paid teacher assistant or the highest paid teacher assistant? That's up to you. What you think would be fair market value for that particular job. Okay. As a director, I would have put it in as the startup rate, as the lowest, as somebody who is just starting out, because they wouldn't have the experience or maybe the education at the highest level. So as a director, that's what I would have done, or what I did do. Do we need to have time in and time out for each parent, such as policy council, or can we use the minutes call to order and adjournment times to calculate. I would put the time in and time out because you might have a parent leaving early and you or something or coming in late and you don't want to count those minutes if they're not allowed if they weren't there. So I would make sure that you're tailoring it to those specific times and making it as accurate as possible. Will we get this recording? Yes, you will. How about
There
service?
was Oh,
Oh,
go
did I
ahead.
miss some?
Sorry, Sue. No, there was one that, well, it wasn't in the Q&A, but because we got also a lot from the webinar chat feature. And so there was one from a current Learning Genie user. I think April asked, you said that with at-home learning, the activity had to be assigned by the teacher. In Learning Genie, we have set up many activities that the parents can choose from on their own and may not be specifically assigned. Would this be allowable as we know they are developmentally appropriate activities? And typically those activities are as part of like they're aligned to your curriculum. So yes, those would be allowable ones. It's just the way that you all do it. You share it and then they can pick and choose. But yeah, those are all allowable
Yes.
activities. So we just wanted to clarify that for any
Yep.
current Learning Genie
Yeah.
user
And
that might
technically
have
those
had.
are assigned by the teacher because the teacher vetted those activities and sent them to the parents.
Yeah,
So,
yeah, exactly, exactly.
all right.
So.
How about services to pregnant women and their appointments? So, good question. And I don't have the answer to that one. I'm going to look that one up
And for
because
ones that we don't have, what we'll do is in our follow-up, we'll make sure to include that in the follow-up as well. So these are all really, really, really great questions, and I know there's a ton more
yeah. Yeah,
that are
these are
coming in.
great. We couldn't
Yes.
think of everything. I wish we could, but this is super. What if books are donated for family engagement on literacy? So is that something you would buy? Would you buy those books on family engagement? And that's the question to ask yourself when you're trying to see is this allowable or not? Is this something I would buy for the program? Is as a director, as a teacher, would the program purchase this? If the answer is yes, then yes, you can count it. So it would depend on the book. I mean, if it's not an appropriate book, you probably wouldn't want to buy it. And so those you're going to have to really look at individually. How can you document the dental and physical and dental appointments? So you're going to get back that physical and dental exam. Okay. That's how you would document that. And you would have a form for the parent to complete on what time they left, what time they came back, how many miles it was to there. So you would have to have something in place for them to document all of that information. Can we count mileage for parents bringing children to family events? That would probably be unallowable because those are not required. Family events are optional. They're wonderful. We hope parents come, but they're not required. What if they bill Medicaid for their services? I guess, Jody, I'm not understanding that question. So, because we're not actually getting in kind for the services. When we're talking about professionals, we're talking about them volunteering for like health service committee. Oh, I think I know. I think you were referring to like vision and hearing screenings and things like that. But they're still coming to the center, so you could still count that. If we have someone talk at the parent meetings, yes, that does count. They're providing professional services to your parents, so you can count their time as in kind. Yes. Family engagement meetings and parent conference meetings do not count because those are program requirements. Can we claim tickets donated to our Head Start children from our local children's museum? That is wonderful that they do that, but no, because that is not something your program would probably purchase. That would not be an allowable purchase for you to purchase those tickets to the local museum. Is there an upper limit for home learning? I think we talked about that, and no, there's no limit, but again, you're going to be looking at those activities and that documentation and vetting that before you count it. The slides will be emailed, right, Carolyn?
Yes, they will
The
be emailed
presentation?
along with the recording. Yes, and that post survey. I think there's still a lot of confusion or seeing the same questions about the requirement for home visits versus for early Head Start. So I think maybe if you want to just kind of reiterate that, because I've been seeing a
Yeah.
lot of the same question about that.
So when I was talking about really in kind for home visits, I was talking about the space. So the time for the home visits cannot be counted in either program. So really, I was just referring to the space. So the space can be counted for Head Start home visits, but not early Head Start home-based programs. Okay. And that's because the space for the early Head Start home-based programs or home-based programs in general is a requirement that their homes are used. So the time for the home visits cannot be counted in either program. So I hope that clears that up. I apologize for that confusion. Um, Parent book club or parent support group, generally that is not allowable because that, again, that's an activity that they can choose to attend or not. Board members' time at board meetings, yes. At the professional rates, yes. Okay. Can we count toothbrushing, reading logs, and family style dining can be counted as in kind? Reading logs, yes. The other two, no. And what if the family has more than one child that is enrolled? Then they will need to have documentation separately for both children. Okay, because they're probably, well, they might not be in separate programs, but you're gonna want the documentation for each individual child. Can we just use the in-kind portion on Learning Genie, or do we have to use all the data? And you can buy the modules separately. So if you just wanted to use an in-kind module, you could do that.
Correct.
Yeah.
Yes, it's the one thing, it's kind of a la carte, so you can pick and choose which modules it is. So it's not an all or nothing.
All right.
Um,
Someone coming in to fix the organizational computer and printer is an allowable in kind. Yes, because you would have to pay somebody to do that. So if they came in and did that and didn't charge you, then yes, you could count that as in kind at their rate that they would have charged. Again, you have to have documentation to back that up. What should we do if we counted something that you said we can't count? I know from here forward not. Well, at this point, there's nothing you can do. You've already claimed it. So I would just, moving forward, I would just do best practice. I mean, I don't know that there's any benefits to going back and trying to undo what you've already done. And again, if it's unallowable, they'll let you know. Would socializations and parent-teacher conferences, no. Socializations is a program requirement, so no. But you can count the mileage to and from the socialization because parents are transporting their children there. Can you count taxes not paid for being a nonprofit? I do not believe so. I don't think that's, nope. We had cheerleaders come today to do a meet and greet for an hour. Can we use that for in-kind? Were they providing a service to the children? I mean, my first inclination would say no, that's great, that was fun, but they really weren't providing any sort of a service to the program, or you wouldn't go out and pay somebody to do that. Therapist counselors from the school district that we don't pay for, but that utilize TANF dollars from the state. I would check with your fiscal or your grant specialist on that one. Because if they're getting paid TANF, we don't want to double dip. I would just refer to your grant specialist on that one and get some clarification on that. So are we saying parent committee meetings cannot be counted as in kind since the parent committee meetings can be counted as in kind? That is considered Head Start business. So if you have a business portion of at the beginning of a meeting, and then you move into, say, I don't know, gingerbread houses, because that's the time of year we're at, you can count that business portion of the meeting as in kind time because they're doing Head Start business. Okay. For the school department people, again, if you're not paying them, if their salaries are not coming out of your Head Start budget, and they are providing a service to you, you can count that. Same with the OT and speech. Can we claim mileage and time for parents coming in to finish orientation? I'm not sure about that one. That one I'm not sure about. I'm going to write that down for orientation.
And then I
So
think
say,
there was another question because it's kind of more Learning Genie related, where it says toothbrushing is listed on Learning Genie as a teacher assigned activity. Um, because there are activities that are counted that are pulled from their curriculum that's added to the Learning Genie platform. So yes, that would technically count. So I think it was Cherie. Hopefully I pronounced that correctly. But yeah, those would count.
yeah. Regarding space and in-kind, so space can be counted as, I think we already addressed this one. Yes.
So a lot of them, I think we've got
I think
most of
we
them.
got them,
Yeah,
right?
and like we mentioned, we definitely will plan on doing a follow-up session. So in the new year, so look out for that.